So when we're talking about the grieving process, we know that DABDA is the acronym for the grieving cycle. Depression, anger, bargaining, denial, and acceptance are the 5 emotions that you will commonly see somebody go through when they're experiencing any kind of shift in their activities of daily living or any kind of a traumatic situation. I want you to bear in mind, though, that these emotions do not flow in a sequence. They could bounce back and forth. For example, say somebody was exhibiting more anger and then back to depression, and then more anger and then back to depression, skipping the bargaining, skipping all the other emotions. This is common. Sometimes people get stuck in between emotions even. So really, when you're going through a process like this really is a person to person, and just really how a person copes with change. As I said before, families will display very different attitudes, very different behaviors. I think sometimes as medical professionals, you work with a lot of unpredictability, and being able to really remain poised, exercise emotional intelligence, patience, compassion, and empathy, understanding, it carries. You have to be able to understand that these emotions that are being exhumed from the family are not targeting you. It is not you. We become the people that have to deliver the news, but we are not the reason these emotions are there. The best thing that we can do is be that cushion, be that ear. Sometimes silence, I've realized through the years, not every family wants to be spoken to. Some families just need your presence. So I think when we really are going through a grieving process with our patients, it really is very important to become extremely acclimated with who they are, how they grieve, where they come from, and what works best for their dynamic. Because a lot of how they handled things prior to that situation is going to be what we see in that facility, hospital room, in that time. It's the stripes don't change, but the way that we help these families and the way that we handle any kind of kickback can really help. It really can help. Dementia and Alzheimer's is a neurological, it's a slow progressing neurological disorder. For those of you that have had family that have had it, or for my medical team that follows me, we know that there really is no time frame for a patient who's been diagnosed with it. It again is a slow progressing neurological disorder. But there are cases where it is advanced and where it does advance. And person to person, again, like everything is, some patients will exhume more episodes of forgetfulness, and then some patients will exhume more. They'll remain doing their activities of daily living. They'll be extremely alert and oriented. They'll be able to articulate what they want, their needs, and then they'll have their days where they kind of float in and out, even hours. So for all intents and purposes, we're going to use the name Sally. Again, this is for all intents and purposes. Sally, in the morning time, she can be extremely hazed, very confused, not really wanting to be around people. She may not remember much about anything, but come afternoon time, her family walks in, she may remember who they are, and she may even be able to hold a conversation with them. Come nighttime, what we experience a lot is called sundown. This happens maybe around the hours of 3 to 5, 3 to 7. Sundowning is when it appears that the Alzheimer's dementia, the behavior shift changes really intense. And you'll experience more of, if you do, a confusion, a higher state of confusion, a little more on the aggressive side, a lot of anxiety in the patient. The way to handle that, of course, would be music. I think music has been found, from what I've seen from working with my patients for so many years, music is something that truly soothes even those suffering from these disease processes. Play some music, just be present, speak to them. Maybe they have to use the restroom. Again, I think in some stages of dementia and Alzheimer's, there is an inability to truly vocalize what they need. So whenever you are seeing this kind of a very anxious state, there is a need. What that need is at that point, because you are dealing with somebody who has regressed, you have to then identify what that is. It could be something just as possible as they're uncomfortable where they're sitting. Maybe you need to shift them. Maybe they need to use the restroom. Maybe their shirt is bothering them. Maybe they have an itch. Maybe they just want to get up and move. But there is a lot that comes with truly knowing how to work with somebody who suffers from a disease process such as this. When we look at the beauty in medical interventions with these chronic disease processes, I continue personally to be very, very proud of the teams that I've worked with. And I've really continued to be even more proud of the families. Because being on the opposite end, being the medical professional, I would be afraid. You are experiencing things that you've never experienced. You're hearing words you've never heard. And like I said before, it has taken me years to grasp a true understanding of these conditions. I can't imagine what it's like to experience it for the first time and then experience it for the first time with my family member. That's almost fluid overload, information overload. It's too much. So I could definitely understand why the reactions are the way that they are in the families. But I want the families to understand that we are aware of this, and hopefully there's that comfort in there, and you guys realize we truly are there for you and your family. Hopefully you guys found this information helpful. Again, if you are struggling and helping a family member through such a disease process, always reach out. There are resources everywhere. There are medical teams who are extremely seasoned and educated in the chronic neurological disease processes that are there to help you. If you are seeing the beginning warning signs of mild cognitive impairment or dementia, such as forgetfulness, sometimes maybe your parent, relative, somebody that you know may be getting a little lost, disorientation, jumbling of their words, I think an assessment is always the first step in identifying if possibly it's just a bad day or if we are approaching an early onset of the disease processes. Again, hopefully you found this information helpful. My name is Jennifer. Go ahead and like, share, and tag somebody who needs to see this video. My Instagram @littlefit, PHIT_nurse. Snapchat FitPHIT_nurse25. Thank you guys so very much for your time. Have a fantastic day.